Welcome to this explainer. Look, if you've ever felt your stomach absolutely drop at the very thought of going under the knife, let me just start by saying this: you are definitely not alone. The anxiety surrounding surgery is incredibly common, and honestly, a huge part of that fear has absolutely nothing to do with the actual procedure itself. It's all about the process of going to sleep. So, we're going to break down exactly what happens while you're under, using the absolute latest clinical data to hopefully bring you some much-needed peace of mind. It's a visceral, almost primal fear, isn't it? That terrifying what if. What if the medicine doesn't work quite right? What if you're just lying there, completely aware but totally trapped inside your own body? It's a nightmare scenario that haunts so many of us before we go in for general anesthesia. It's a really heavy thought, and it's completely valid to feel a sense of dread when you're handing over total control of your consciousness to someone else. It's literally the ultimate fear. Hearing conversations, feeling pain, and being unable to communicate. You know, stories from well-meaning friends, sensationalized articles on the internet, and those late-night rabbit holes we all go down, they just amplify this terrifying idea. I mean, the mere thought of being paralyzed, wide awake, and feeling the surgeon's scalpel is enough to make anyone want to just cancel their operation and run for the hills. Okay, let's dive into this. Hollywood loves to tell us one very specific story: dramatic sudden waking, agonizing pain, and sheer panic while the doctors are just completely oblivious. But the clinical reality of a modern operating room, it's entirely different. We're talking about continuous monitoring, incredibly precise modern drugs, and immediate real-time adjustments. The truth is, modern anesthesia is actually quite boring compared to the movies. And believe me, when it comes to surgery, boring is exactly what you want. Section 1. Defining the reality. What exactly is AGA? To strip away all that Hollywood mystery, we first need to define what the medical community actually calls this phenomenon. In medicine, this condition is known as accidental awareness during general anesthesia, or AAGA for short. The clinical definition is retaining partial or complete memories of events that occurred during surgery. Notice how specific that is. It focuses entirely on the retention of memories. But it's absolutely crucial we look closer at what retaining those memories actually means for a patient in real life, because I promise you it rarely looks like what you might imagine. And this brilliantly illustrates the reality of the situation. The vast majority of people will go to sleep, have their surgery, and wake up in recovery with zero memory of the event. None. Thanks to modern techniques and incredibly rigorous protocols, that tiny sliver representing rare cases of awareness is exceptionally small. You can literally breathe a massive sigh of relief right now, knowing just how incredibly unlikely it is to ever encounter this complication. Section 2. Does awareness equal pain? Even with those incredibly reassuring odds, we still have to address the core of the nightmare directly, because the most pressing question on anyone's mind isn't just about being awake, it's about suffering. When we look at what awareness actually looks like based on real patient reports, the picture changes dramatically. Most patients who report AHGA describe hearing voices or remembering the rhythmic sounds of the operating room equipment. Some report feeling a vague sense of touch or dull pressure. What they're largely experiencing are auditory or mild tactile sensations. Now, is it disorienting? Sure, but it's a far cry from the agony depicted in those thriller movies. So, the crucial point is this: we need to permanently decouple the idea of awareness from torture. Severe pain does not automatically occur. Even in the highly unlikely event that your brain forms a memory during surgery, it does not mean your body is experiencing unmitigated pain. The reason you're protected from pain is all because of the way modern anesthesia is administered. It's a highly sophisticated, multi-layered approach. You aren't just getting one magical sleep potion, you know, the kind where you fail at counting backward from 100 before you even hit 97. Instead, you receive specific medications designed just to induce unconsciousness, completely separate heavy-duty pain-relieving medications, and muscle relaxants to keep your body still. So think about it. Even if the medication keeping you unconscious were to lighten for a brief moment, allowing a memory to form, those powerful pain-relieving drugs are still working overtime, blocking the pain signals from ever reaching your brain. Section 3. Behind the curtain. The science of staying asleep. The anesthesiologist isn't just turning a dial and taking a coffee break. They are performing a complex, continuous balancing act throughout your entire procedure just to keep you safe. It's a really delicate balance. On one hand, the goal is deep anesthesia to ensure complete unconsciousness. But on the other hand, they have to prioritize your overall safety, which means maintaining vital organ functions. You see, anesthesia impacts your heart and lungs. Sometimes, putting a patient into an incredibly deep sleep could dangerously drop their blood pressure or stress their heart. So in certain critical situations, the anesthesiologist will intentionally use lower doses of anesthesia, simply because a deeper sleep could actually pose a greater risk to the patient's life. Now, what's really interesting about this setup is how the anesthesiologist basically acts as a brilliant medical detective. They're constantly monitoring all these parameters in the control room of the OR. Long before you'd ever wake up or form a conscious thought, your autonomic nervous system reacts. If the anesthesia starts getting even a little too late, your body sends warning signs. Your heart rate increases, your blood pressure elevates, or your breathing patterns change. The anesthesiologist reads these physiological signals in real time and adjusts the sleep depth instantly, long before any awareness can actually occur. And we've got some incredible technology to help with this too, like BIS or bispectral index monitoring. These are special sensors placed directly on the patient's forehead that literally analyze your electrical brainwaves to assess exactly how deep the anesthesia is. Now, while no single piece of tech is a 100% foolproof guarantee, advanced tools like BIS monitoring add a really powerful extra layer of safety, especially for patients who might be at a higher risk of awareness. Section 4. Who is actually at higher risk? Let's shift gears to some objective data so you can accurately assess your own situation rather than just letting fear run wild. First, we have procedural risk factors. The risk of awareness does tick up slightly during extreme events like severe trauma, massive bleeding, or emergency surgeries. It can also be higher in certain obstetric procedures or if a patient has severe heart failure or really unstable blood pressure. Remember that balancing act we talked about a minute ago? Well, in these extreme life-or-death scenarios, the anesthesiologist simply must prioritize keeping the patient's organs functioning and keeping them alive, which sometimes necessitates running that anesthesia just a little bit lighter. Beyond the procedure itself, there are also individual patient risk factors to keep in mind. If you have any history of previous awareness during anesthesia, your medical team absolutely needs to know. Additionally, the regular use of opioids, heavy alcohol consumption, or the use of certain psychoactive medications can actually alter how your specific body processes and metabolizes anesthetic drugs. These are just incredibly important variables for your anesthesiologist to track so they can dial in your perfect customized dosage. Section 5. Taking control of fear. Now, let's move to our next step and see how this builds from the science into actual empowerment. Focusing on what you can actually do. Here is a highly actionable pre-surgery plan for you. Step 1. Speak openly with your anesthesiologist. Seriously, do not be embarrassed. They literally hear these exact concerns every single day. Step 2. Evaluate your individual risk factors together. Be completely honest about your medical history and whatever medications you're taking. And Step 3. Review the customized anesthetic plan they've created just for you. Honestly, understanding the strategy they have in place is one of the absolute most effective ways to extinguish that pre-surgery anxiety. At the end of the day, I really want you to take this to heart. Your safety is continuously monitored by a dedicated medical team. You are never, ever alone or ignored on that operating table. From the monitors reading your vital signs to the anesthesiologist standing right beside you, you are the singular focus of highly trained professionals whose entire job is to keep you safe, asleep, and comfortable. So, I'm going to leave you with this final thought. When you're lying in that pre-op room staring up at the ceiling, are you going to let fictional movies and internet horror stories dictate your anxiety? Or will you trust the science, the data, and the incredibly dedicated medical experts standing right by your side? The reality of modern medicine is astoundingly safe, and you, my friend, are in excellent hands.